today, myopia is on the agenda in places such as China, where President Xi Jinping made myopia a national issue, and places like Singapore and Taiwan also have public health activities such as posters and TV commercials about slowing myopia progression going outdoors. It was after this meeting that Professor Brian Holden, myself, Earl Smith, Serge Resnikov, Kovind Naidu, we recognised that we had to continue the efforts, and that's why we formed the International Myopia Institute, which is a working group to continue the efforts to advocate for myopia as a public health issue. I want to say that we can all make a difference. There is tremendous hope in the eye care profession today. The scope of practice is increasing for optometry, and our profession is growing, not just in myopia, but also in dry eye, such as TFOS. The scope is increasing.
On behalf of the International Myopia Institute, I wanted to thank the University of Faisalabad and the organisers of the World Sight Day Hope in Sight meeting. What a pleasure to be here today to share the findings of the International Myopia Institute with all the students and the future optometrists in the world. All the resources that I mentioned today are freely available, and I look forward to meeting you again in the future. Bye.
So as I say, greetings from Australia. I'm based at the University of New South Wales, which is in Sydney. But actually, I didn't train in Australia. I did my training in the UK. And when I was looking for information about your university in Faisalabad, I discovered, of course, that Faisalabad is twinned with Manchester, which is where I did my optometric training. And when you look at the architecture of these places, it's not surprising that they're twinned. It's remarkably similar, that you have these similar looking towers in the two great cities. The final students I want to talk about, I'll mention in a second, but the area that he's working in is really quite fascinating and very interesting.
Okay, thank you very much. I'm grateful to University of Faisalabad, Professor Amirali Chaudhary and his team for giving me the opportunity to participate in this international webinar on Hope for Sight. And today is the World Sight Day, and we were supposed to celebrate here in Lahore as well. But thinking that this international webinar is very important, so we postponed our celebration to next Thursday, just to maintain and just to participate in this webinar. future is basically, future plans are the trachoma elimination by 2021 and incorporation of inclusive eye health in the curriculum of optometry across the country, establishment of low vision clinics at DHU hospital, which will be manned by the optometrists, community for eye diseases at rural health center, which will be manned by the optometrists, and eye health information system. So these are our future plans for next 5 years. So thank you very much for your patience.
So welcome everybody. Thank you for having me to speak to you today on this really important day that you are celebrating. I'm going to talk to you about evidence base in eye care practice and with a particular emphasis towards contact lenses. But this is very relevant to all of the areas that we practice in to make sure that we can best provide services that are optimized for our patients. And of course, as part of that, then to reduce visual impairment. It is important for us to understand where the evidence is. It doesn't stop us suggesting things that might be sensible, but again, we should be explaining where the evidence is, looking for ourselves or other people to provide that evidence and changing our practice accordingly. So I must thank the BCLA who are supporting the initiative with the Clear Reports contact lens evidence and academic reports. And thank you very much for your attention today. But I wish you all the very best in terms of your initiatives to support visual impairment, and hopefully we can do that supporting each other and making sure that we are providing the best evidence-based practice for our patients. Thank you.
Here is Amara Fee. I am presenting topic of my research. So today, common question arises, is there any association between sunlight and myopia? The answer to this question is yes, there is a strong association between them.
Thank you all so very much, and thank you for your kind appraisal and comments. And I hope that we will all pledge to keep hope in sight. We have learned a lot about evidence-based practice from Dr. James. We are very thankful to him. And we have learned a lot from Dr. Monica, Dr. Eric, and Dr. Asad Aslam Khan. We will now be concluding this webinar.